All right, welcome everybody. This is another informational interview, and we're here today with Madeleine Martinez. She is a nurse at Methodist Hospital in San Antonio, Texas. And so, Madeleine, without further ado, go ahead and introduce yourself a little bit, and we'll get into it.
Perfect. Hi, everyone. My name is Madeleine Martinez. I'm currently a nursing student, but I will be a nurse after I pass my boards. I'm at my tail end of nursing school. I finish in September in 3 months, so that's really exciting. It's been a very long process. I'm very proud of myself. I've been working in the hospital for 4 years now in healthcare, and it's been a lot. I've learned a lot. I've seen a lot, and I'm really excited to get into the field as a nurse and do what I feel like I was meant to do. So I'm excited about that, and very excited that Clay was um, very sweet to invite me to this and let me talk about my journey with nursing school, and hopefully it inspires some of you.
Cool.
Hmm.
Thanks, Madeleine.
Of
And
course.
so today we're just going to go over some questions. We got about give or take 20. They're going to be over background and career paths, day-to-day work, work environment, professional development, and advice for new nurses. And so, without further ado, let's go ahead and just jump into it. And so, Madeline, what inspired you to become a nurse?
What inspired me about nursing is I knew that to be a nurse, you have to be very caring and nurturing. I like seeing people like improve in any form. I like knowing that I um had like some control over that. I know that I was the one to help them. It's a really rewarding, very rewarding career, and that's something that I really wanted to get into. It's a very selfless job as well. um I don't know, it's taxing in many different ways, but it's also, I feel like it carries a lot of pride in like how much you're learning along with it too. Like you're learning something new every single day at work, and because it's just science is just improving, and as well as what's it called, science and research with like diseases and just the anatomy of the human body. It's growing more and more and more. So I really wanted to get involved with that.
Yeah. And so, considering all the different avenues that kind of are regarding nursing, is there anything that you specialize in or anything that you'd like to specialize in?
I don't specialize in anything right now. Eventually, I would love to specialize in labor and delivery and delivering babies, or even be a midwife, which is kind of more like a holistic side of things, where if you really want to, women have babies at home. They have them just in a different area other than a hospital setting. It's definitely more natural. It can be natural. Um, but there's also many risks with that as well. But that being said, I'd like to dabble into that after maybe being more of a seasoned nurse, so to speak, because I want to learn as much as I can and get all my skills ready. But right now, I work on a med surg floor, which we pretty much get all different types of patients, different walks of life, different demographics, different surgeries, different medical conditions. So it's not there's no niche in it. It's just really you see everybody, which is I think a very good profession or unit to work on like when you first get into nursing.
Yeah, and considering the fact that there's so many things that you need to know about,
Mhm.
can you talk a little bit about the schooling that's involved and maybe kind of your path as far as schooling to get to where you are?
To get to where am now, it's took I my path has been in different areas, different directions, which is so welcoming of nursing too, because I have so many kids in my class that are of different walks of life. That some people that have a degree in I'm trying to think of like business degree or something like that, and they decided I don't want to do this anymore, so I'm going to go into nursing, and they're now what, like 34 years old and finishing with me, you know. um it's good for everybody. When as far as my path goes, I have a another degree in biology that I received at York College in Nebraska. I didn't exactly know what I wanted to do, but I knew I wanted to do something in science, so I had a general idea, and I wanted to make sure that this was the right path for me. So I went and worked at my hospital that I work at now as a nursing assistant for a few years. And the first 6 months, I was like, I don't think I want to do this at all. This is really hard. And like, it's so, the environment can be really good. It can be really bad. It's up and down. It's all over the place. So, um, after some time and thinking on it, I knew that this was what I needed to do and what I wanted to do. And it's a lot of energy, it's a lot of time, money as well. And um, I think I was ready for it. So I decided to just like bite the bullet, apply for school. I got in, and 3 years down, and here I am. So that's my path with nursing.
Nice. And so, yeah, you still are a student, but you are working at a hospital. And so, maybe speak on kind of what the employment looks like as far as, the process of getting employed at a hospital.
Well, the process of being employed at a hospital, I did not have any prior experience. So and I started on the surgical floor. And so I got in contact with the director, had an interview. She told me about all the different floors that they have. She let me know that there were some floors that are the workload's a lot different. It varies on each floor, but she let me know that on my floor that the workload is a lot, very fast paced. You have to keep up with everyone. It can be rather challenging. So I said, let's do it. And I signed up to be a PCT, which is called a patient care assistant. There's also, what's it called? A CNA, which is certified nursing assistant, but you go into a class and you take classes on it. I think you have to pay for it as well. To be a PCT, the hospital supplies the classes for you. So you go in, you do training, you get your uniforms. They make sure you know how to take vitals appropriately, that you know the ranges that you need to report to the nurse, if the blood pressure is too low or too high, how to take a patient's blood sugar, and different things like how to talk to a patient. But a lot of things like they teach you the, let me see, the meats and potatoes, so to speak. But when you're in there, you're still learning a lot more. Like when they didn't teach me in during my courses for PCT how to do a bladder scan on someone or how to do an EKG. I just remember being on the floor and they're like, Madeline, we need EKG on patient 512. And I was like, I have no idea what that is. And so another nurse and tech like pulled me aside. They're like, no, we'll help you, we'll teach you. So you're learning on the go as well. Um, but I interviewed, yeah, you would interview with the hospital. They'd place you where they think is best. But you're also, there's a lot of availability for you to move around and transfer. Mhm.
Would you say that experience that you did while you're taking your classes is valuable? Um, Because I know some students might have an idea in their mind that, I'm going to go to school and then I'm just going to get my job. But does it always work like that in nursing?
No, it doesn't. I, yes, I'm working all through school at the hospital. It does help because you're seeing what you're reading about in a textbook. You're literally seeing how the patients interact with the doctors, or like how patients interact after, or what's it called? How the patients are after a surgery. Like you're seeing it head on, where in school you're reading it in a textbook or you're getting a lecture from a teacher, which is still beneficial for sure. But I would say working as a tech or working um, in a healthcare field prior to nursing is very beneficial, just to see if it's for you, because it's not for everybody. And there's certainly quite a few people that I've worked with where they went in knowing that they wanted to go to nursing school. This is what I want to do. And then a year or two, working at the hospital, they change their mind, which is totally okay. They go towards something a little higher, like PA school, or they do something completely different, which is totally acceptable because it is a job. You don't have to like want to be a nurse or need to be a nurse to work as a PCT. It pays really well. It's very rewarding because you're helping do general care for patients like day to day out. So no, it's a very rewarding job. But working, yeah, during school is very taxing. It's very hard. You have to know a lot of time management and balancing your work life balance. which is very difficult at times, but everyone is so different too. So yeah.
Yeah. And you kind of touched on this as we kind of go into the day-to-day work. But what does a typical day look like for you?
A typical day is so they're 12-hour shifts. So from 6:30 and you clock out at like 7 because you take a 30-minute lunch. You clock in, you make sure you clock in on time, because they'll dock you for that for sure, just like any other job. You see your assignment on what patients that you have and what nurses you're going to be working with. It changes every other day. Um, and then you get report, which means you go with the PCT and you go to each door of all the patients that you have, and they give you a generalized report. This is 512. They came in for this diagnosis. They're able to walk with the walker, but make sure you stand by them. She likes her coffee with like 2 sugars, very just specifics, like, or she fell earlier last night, so she won't be getting up today unless there are 2 nurses at the bedside. So just tell you, like, do not get the patient up unless there's another nurse with you. Just um, so we get a report on each patient, and then we take vitals 3 times a shift every 4 hours. We take their blood sugars. We make sure all the patients' beds are made, that they feel clean. If not, then we assist them with a bed bath or a shower, help the nurse with other tasks as well. There we can't manage any medications, nothing like that. It's really all general care for the patients. The only people that can do medication administration are the nurses. So, and they're very serious about that, and they keep an eye on every one of them in the profession. So it's very
So,
safe. Yeah.
yeah, kind of sounds like be good if you like routine, but you want a different rhythm. If
Yeah. No, yeah, it's I'm one that really likes structure. So at a hospital, that's really hard to have. But if you can manage it in your own way, it works really well. Like I've managed my own structure. I get to work, clock in, get my report, I clean my vitals machine, I write affirmations every morning, and I put it on my cart for me to like glance at and just to make sure I'm feeling good, I'm having a good day. And not let, little things get to me, because it's just things can go so south so quickly just at a hospital. So you just have to be prepared for anything. Yeah, and just go with the punches, I suppose, but so to speak.
makes sense.
Hmm.
And so, there's probably a variety of patients that you work with. But what kind of patients do you typically work with?
I typically work with, so I work at a downtown hospital. So we have all different types of demographics. We do care for a lot of the homeless people in San Antonio, just due to the location. Um, we have people from out of town. We have people, who fell at the Riverwalk. So then they brought up to to our hospital because we're just the closest one. Um, Care for patients recently out of surgery, because our floor is med surge, ortho surgical. So we have patients that just had like an amputation done, a hip surgery, um, just major surgeries usually, or bariatric surgeries where it's like the weight loss surgeries where they put a band around your stomach kind of thing. Yeah, mainly get those.
Yeah. And so it sounds kind of like your role can kind of change depending on the day.
Hmm.
Uh,
Absolutely.
but what skills would you say are important to have if you're a nurse?
When you're a nurse, really good skills to have is being a good listener and being able to build rapport with your patients or with doctors, with your staff. Because if you don't have a good community, a 12-hour shift can go really slow. I would also say multitasking and organization, major, major things in healthcare, being a nurse as well. Um, you're going to be caring for up to 5 patients a shift. All those patients have different meds due. All those patients, have different orders from the doctor. Like the doctor wants them to walk 3 times a day. You have 5 patients, and you only have like this many hours to get it all done. Which is why we delegate to the PCAs like me. Um, I would say being able to delegate, being able to know how much you can handle at once, because you can't do it all. And that's when good communication skills come in. You need to be able to communicate with your team members, like any other job. Like it is a team. It is a
Mhm.
team. Mhm.
Yeah, and with so many things to do, I'm sure you get pretty swamped and it can get pretty stressful at times. And so, how would you go about managing that for your work-life balance?
Work-life balance. Well, I mentioned earlier, I write affirmations every morning. That's something that I've been doing for, I think, since I started working there. The first 6 months, I started doing that. Just something, and I tape it onto my car. It's just a little tradition I do. I tape it on my car, and if I'm feeling blue, I feel down about something, or I'm questioning something, I look down and I see that I wrote, "I am capable of having a good day. I am proud of myself for getting through the week. Um, I." Um, I am wise and strong, kind of something like that. When it gets very crazy and I need a minute to myself, I'll go into like the break room. I'll go into just one of the supply rooms, and I just take a few deep breaths. Just go, just let it out, kind of thing. Because I don't know, I would never want anyone to see me upset. Because you see some things that are pretty upsetting. That make you upset. They make you mad, angry, just all the feelings. And but you got to get through the shift. You got to get through the day. So taking a minute to yourself and just like relaxing, watching a funny video real quick. Um, I don't know, calling someone that you really care about, that really helps too, just when you have a minute. But yeah, I think time to yourself and reflection really helps with me, for me.
Cool.
Mhm.
Yeah, and I assume your work is probably pretty accommodating with that, kind of depending on probably what the culture is at your hospital. Um,
Mhm.
but sounds like you have a pretty good one at yours. So could you maybe talk a little bit about what the culture is like where you're working?
The culture I work at, I like my team a lot. We have a lot of nurses that have been there for years. Oh my goodness. And it's so funny. We have a lot of different personalities on the floor as well. But we all like to work with each other. We're all very, I don't know, nothing's a dumb question. Like um, I'm very comfortable asking for any help from any of my nurses, or um, just assistance from any other techs as well. Um, Talking about the community and what was the other part of the question? I'm sorry.
Just what's the culture like at your work and maybe like how they accommodate you with certain things as far as, like if you're stressed out, if you need to
Oh
take a
yeah.
sick day, that kind of stuff.
Oh yeah, they check in on everybody. We do peer interviews with each other, or reviews, I should say, where we just check in and see how are you doing. A lot the staff knows that I'm in school as well. My director does a really good job working with my schedule. I can only work a couple shifts a week, and of course I'd love to work more, but just gotta make it work. But no, I let her know when something doesn't work out, and she's able to change it. But that goes both ends. Like I have to be good on about my schedule. I have to know when my exams are. I have to know when I need to hit certain dates. So yeah, yeah, you have to go back and forth, but no, it's a good environment for sure. Hmm.
And speaking of, the scheduling and all that, I hear a lot of stories about, when you first start nursing, you probably get the graveyard shifts and then kind of move your way up. That might be a myth. So, what I wanted to know is maybe what does your shift look like, and do you typically work by yourself, work with a team, kind of what that looks like?
So you work by yourself for sure because you are only assigned to your patients. Um, but yeah, when you first get into, depends on the unit and what their needs are. So on my floor, they offered me if I wanted to work day or nights because we had availability on both. I chose days because I've never worked a night shift ever, and I do not feel like losing sleep. I kind of want to get back on my track for after school, please, dear God. Um, but some people prefer it. Some people love night shift because it's a different environment. It's more, well, I'm not going to speak for it, but I've heard it's just more laid back. The perks of working night shift is the families are not there in the rooms with them, and they can be a little overbearing sometimes. Um, and which is they have rightfully so, totally get it. Doctors don't round around that time either, so it's just I want to say quiet. It's just more laid back. It's quiet. there's less chaos. There's a lot less chaos, but of course, it goes back and forth. And then the day shift, you have all the therapists are walking around, the nutritionist is walking around, the doctors are walking around, patients, families are, at the nursing station looking for water or a blanket. There's kids running around. It's just not running around, but they're going to the candy machine and stuff. But yeah, it goes back and forth. I like the day shift because I don't know, I want to go home and go to sleep.
Yeah, that
Yeah,
makes total sense, I
yeah,
think.
for sure.
Um, and so we've talked a lot about, some of the things that you do and how they can be really challenging at times, but the fact that you're still doing it means that there are some pretty rewarding things as well. And so, what
Mhm.
are some of the most rewarding parts about being a nurse?
You get a lot of good feedback from the patients. I've had a lot of patients tell me like how good their care was from me or some of the nurses. We do these awards they're called B awards, and then there's Daisy awards. So the nurses get the Daisy awards, and then the PCTs or the techs, we get the B awards for like the little helping bee, and we get those when the patients fill out. It's a form that talks about which nurse or which healthcare worker would you like to recommend for an award, and they write why, and they just give a little summary of what their care was like and why they think we deserve it. And I've received one, and it's really sweet. I don't know. They give you a little the little B award, and then they give you what the patient had to say about you, which is super cool. And what keeps us actually more of a community. So all the submissions that we get for the Daisy Awards and the B Awards, our director will black out the names that they are trying to award, and she what's it called, puts them all together. She has us read them, so we don't know who they're talking about, but based on what the person said about their care, we're like, that was really nice. So we all like choose who gets it. And at the end, we realized, oh, they were talking about Dennis the whole time. Like that was Dennis's patient. So, and it was just cool. So we don't know who votes for who. I mean, some people you'd be like, I know who that was, but oh no, that's super good. It's super neat. So it's not only going through the patients who are turning in those flyers. It's a bunch of people looking at it, so you're chosen not by just one person but by like your staff. They thought that you did a good job too. So I've gotten one of those. And the nurses get the Daisy Awards, which is really sweet. And they're just little pins you get to put on your badge. And I don't know, it's just, and when you look down, it's just a reminder that you were appreciated, you are appreciated. And patients are really grateful for the care that they're given a lot of the times, and even the families, because you're there through a lot of hard stuff. You're providing care to them when, I don't know, when patients come in and they are not able to care for themselves, but they're so used to being independent at home. It's very vulnerable, and you see them in many different stages of grief, because they could be ugly, they could be mean, but they don't mean it. I used to get hurt by that if I felt like I was just gonna kind of getting like a cold cheek from a patient, but or cold shoulder, I should say. Um, but your skin gets a little thicker, and I've had patients get a little ugly. They say means things that they don't mean, and later on they'll be like, "Hey, what I said was wrong. I'm really sorry. I was just really upset, and I'm really because like I haven't been home in a few days, and I just don't want to be in this bed anymore." And like, you don't know what they're going through. Like everyone's going through something. So yeah.
Yeah. Yeah, it sounds like you kind of deal with, the healthcare aspect, but you also have to deal with the human aspect quite a bit as well.
Yes. Yeah.
Wow. Well, good. And so, speaking of, the health aspect of everything, in healthcare, there's going to be a lot of advancements that happen, in any amount of time. So, what I was wondering is, how do you stay current with any of those advancements? Are there any classes that you take for it, or
Mhm.
just how do you go about that?
Our hospital is really good at notifying us and letting us know if there's any updates on just world situations, any mainstream, like widespread things that are going through, like COVID's going through again, or different diseases possibly. but we do have huddles before every shift. So we just give updates on the floor, the hospital, like what the director said, or just any important dates coming up. So that keeps us updated as well. And we do have to fill out, they're called health streams, and it just keeps us updated on just more information. So it'll let us know about a new therapeutic like air mattress for some of our bigger patients because the one thing, well, the many things that you don't want to get at a hospital are pressure ulcers from sitting in bed for so long. And when you are of bigger size, you're more capable of getting them. So I don't know, there's new research out there. So they make different beds and chairs. So it's our responsibility and sometimes we forget. So our director reminds us like, hey, everyone needs to go fill out their health stream because it's modules, so to speak. So you look through the slideshow, you do a quiz at the end to make sure you understood the information, how to use the new bed that's coming in, or yeah, there's always new stuff going on, like new equipment too, just updated things. Like I'll come into work and I'm like, what is that? And everyone, it's a new trach system, and I'm like, this is the first time I've ever seen it, but it's because I didn't fill out my health stream. So you want to be updated with the new advancements. Yeah.
There. And in addition to advancements in healthcare, are there any, advancements in your field once you do become a nurse?
Mm, yeah. So when you can become a charge nurse, so that's when usually the charge nurses don't have any patients, and the reason for that is so they can help all the other nurses. So they'll help the other nurses by doing the discharge packets, by answering the phone, by communicating with the family if they need to. Um, I don't know. They help pass meds for the other nurses. You can also past nursing, or if you're still a nurse, you can be a nurse director, which they are not in charge of doing patient care. They rarely wear scrubs as well. They're just professionals and they are in charge of the unit. So they get the information, they get updates. They're the manager of the floor, so to speak. There's also a nurse manager, a nurse clerk as well. And then it is the social service nurse kind of thing. The social worker. Yeah.
Yeah.
There's you don't only need to do bedside nursing where you're giving meds and care to the patients. That's why it's really exciting that there's a lot of different avenues in the environment and in the career. So yeah, it's flexible. So you can do different things. You don't have to you don't have to do that.
Uh, all right. Well, I got three more questions for you, and I'll just ask them in a row here.
Okay.
With
What?
nursing, I understand that, everybody kind of has an assumption of what the job is going to entail. But are there any misconceptions about nursing that you have encountered?
Misconceptions. I would say not all nurses are mean. There's some really, really nice ones out there, and not all nurses are nice. There's some nurses that probably should think about something else if they if they feel so badly about their job. But that's why it's so important. Like, it's not going to be easy. It's not going to be like terribly, terribly hard all the time. But it's how you carry yourself. But that's with every career and every job that you choose. You're not going to want to be there some days, and no, it's so rewarding. That's why it's such a good career to be in. But another misconception I would say is that all nurses are female. There's many male nurses, but not too many. On my floor, I think there's maybe four male nurses, and they're all super wise, super smart, super sweet people. Yeah, there's a lot of different male nurses I've seen, and in different areas. So I would say that's the only misconception. I don't hear too many misconceptions. I feel like nursing, it's pretty straightforward what it is. Yeah.
Yeah.
Mhm.
All right. And so before, going into the nursing field, I'm sure it was all brand new, right? And
Mhm.
so Now that you've been in it for a while, is there anything that you wish you would have known before you entered the field?
Oof. I guess be because I feel like I really heard a lot about burnout. And I see it to different degrees um, on my floor, and I'm definitely seeing it a lot at school. I'm not feeling that necessarily, but I wish I would have known more about. Hmm, Maybe about time management. I really didn't think I was gonna have to, such a silly thing to say, study as hard as I need to, but also everyone learns at a different like level. I really need to hone in and study if I because I it just takes me a minute to get something. It could be something pretty simple. Like I don't know, you don't want to see me try to understand a card game. That's so hard for me. So or a board game. I'm like, let me see the instructions again. I need a highlighter. But I think how much time to study. I didn't realize how much time I would have needed to study. Um and how much I had to say no to so many things. As far as like, going out with friends or trips. Oh my gosh, I haven't been on a trip or left Texas. Wow, in a very long time. But that's also due to like many different things. But oh, yeah, it's a yeah. I feel like I broke a record right now. I'm trying to think of something because like I think time management. Yeah, just you don't have a lot of time to do extra things. It's just studying and nursing and school. It's a commitment. It's a full-time commitment because at the
Mhm.
end of the day, you're in charge of saving someone's life possibly, and that's kind of a really big deal. So you need to study and you need to know your material, and the school and how hard it is to complete is, it's reminding you of that because it's not easy. And the passing score at my school, the the grade ranges from different schools, but a 74 at my school is that's barely passing. So if you get a 73, you failed like the exam, so you need a 74 or above to pass, which at normal colleges and normal schools, I remember I think at where I went to college, failing grade was 60. Yeah.
Mhm.
Yeah.
Well, good.
Hmm.
I guess the last question I got for you here
Hmm.
is pretty generalized, so it can change depending on how we answer. But what advice would you give someone considering a career in nursing?
I would say I would say go for it. I would maybe other than watching this interview, and I hope it helps you, maybe go on YouTube and look up different, not just nursing, but what areas in nursing are you even interested in? Because there's tons of people who vlog their experience who really talk about it, and they're talking to people, especially exactly what you said. Like if you're remotely interested in it, like this is why, the pros and cons, so to speak. The pros is that um, it's a really good job financially for yourself. It's good to support yourself through it. You learn so much, so your brain is just gets bigger, bigger, and bigger. A lot of pride points towards that. Just you're walking around with so much knowledge, and it's so exciting and it's interesting, and it's like I don't know. It's a really rewarding career. Some cons. Um, it can be kind of challenging to figure out a work life balance for sure, but it's totally doable. I would say I would try to work in a hospital or a clinic or do something for a couple days or um, just to see if this is really what you want to do. Because what it doesn't feel good when you're in it and I don't know, you're a year in, you're just like, I don't even know this is what I want to do. Because you're wasting your time, you're wasting your resources and your money, and no one wants to do that. So I would try to get an eye in on what you want to do and if it's best for you, healthcare, because it could change day and night. Um, but it's good to have a solid idea before you invest so much time into it.
Awesome.
Mhm.
Well, that was my last question for you. So
Okay.
thank you so much for joining us today, and uh, maybe we'll catch you on the flip side.
Okay, sounds good. Thank you so much.
Right.
Bye.
There we go.